when we're doing some of our heavy lifting, we're coming out of a deadlift or anything that we're trying to pop our hips so we can lift up over our heads. If we don't get full extension of our hips and we engage our glutes, then we don't get that pop forward, and that limits how much we can translate that weight up. So when we have limited motion forward, yes, it could be weakness of our glutes, but it could also be tightness in the front of the hip. That could either be from muscle tightness or it could be from capsular tightness. So if we're going to work on the joint capsule, what we want to do is we're going to have a band anchored about knee height, and I'm going to step right through it. And we want a pretty firm band for this because the hip capsule is pretty strong. Right? I'm going to put it right up near the fold of my butt, and as I step back and put some tension in it, I want to drop my knee down so that I'm in this half kneeling position. And then my mobilization is I'm just going to squeeze that butt cheek and push that hip forward a little bit. And I feel that in the top third of my thigh here. I'm just going to come out of it and squeeze it and push it forward again. Right? So this is causing the ball to slide forward, which is stretching the front of that capsule a little bit. And then from there, we can play around with this. With the back foot is I might want to add some rotation. So I'm going to bring my foot across my body. That puts external rotation on my hip. And I can try it with that again. Right? And that's going to be more on the medial side of the hip. Right? Or I can move my foot to the outside, and that's internal rotation of my hip. And again, I can squeeze it in. It's going to work more the lateral side of that hip capsule. Now when I'm doing this, the goal is not to get a big shift forward or to arch back. It's to squeeze that butt muscle and feel that front of that hip capsule pull. So about the top third of the thigh is where you're going to feel it. And it's just an in and out motion, maybe 5 or 10 seconds, and then relax and do it again, maybe 10 to 15 times. And then that should get a little more mobility in the hips. That way, when you get into your standing position and you're trying to get into that full hip extension, you should feel a little more clean that this isn't restricting you, which allows you to engage your glutes more so you can move that weight up.